Florida ranks as one of those top states with the human trafficking problem. 3% of the respondents reported that they had experienced sex trafficking as a minor and 4% as an adult. And we have a lot of community risk, but we also have a very impactful response to human trafficking. And so I don't want to discourage anyone in Florida from thinking, this is a battle that we can't win. Florida's a leader in understanding the human trafficking problem based on data. It has been very rewarding to see research get connected to policy in such a quick and impactful way.
If you'll start us off by introducing yourself, your organization, and what you all do.
I'm Dr. Joan Reid, and I'm a professor of criminology at the University of South Florida on the St. Petersburg campus, and I'm also the director of the Trafficking in Persons Research Lab that's on the St. Petersburg campus.
Can you tell us a little bit about what the Trafficking in Person Lab does?
Sure. So the Trafficking in Persons Lab was opened in March of 2020. We have three kind of unique goals that we set out to accomplish. That one is to spread knowledge and do interdisciplinary innovative research on human trafficking to try to answer some of those questions that remain around human trafficking, around who are the offenders, who are the, survivors and victims, and how we can best alleviate and end human trafficking in Florida. Most of the faculty at the research lab are practitioners first, and we kind of got into research as a way of answering some questions for practitioners. And so I think we're very much action oriented and, want to be part of the community and answer questions for practitioners who are working in the anti trafficking field.
Thank you. Can you tell us about the Bright Network and the Bright Referral Network?
Sure. So when we opened the TIP lab, the first thing we did, it was March 2020, if you remember what was going on at that time. And so what we did was we conducted a needs assessment. And I think somehow, believe it or not, starting this in the middle of a global pandemic somehow was beneficial because our reach went beyond just the Tampa Bay area. So because everything was done remotely, we interviewed over 100 anti-trafficking leaders asking like, how can we serve you? What can we do for you? Really two loud requests came from the community. And one of those was better data. Most people felt like they didn't have data like about their area, their region, their section of Florida. So they didn't know, is the problem huge here, small here? How can they best respond? And the second request was a better way to connect survivors to services. And I had been researching human trafficking in Florida for about 15 years at that point, and I had gone to so many task force meetings, I couldn't count them. And at every task force meeting, that was an urgent need. And I'm like, okay, I'm tired of hearing this urgent need. We're going to try. And so that's how Bright was launched. Bright stands for Bridging Resources and Information Gaps in Human Trafficking. And so that is really the main goal of Bright is to connect survivors to services, safe services. And so first we vet everyone who's in Bright, and we have a tiered level of vetting. So if you're a food pantry, you don't get the same level of vetting necessarily as a shelter or a housing. So they're vetted, meaning they have a trauma-informed approach to what they're doing. And they have, we've done some background checks on the people that are involved to make sure that that's a safe place. And then once they're in the system, they can refer to one another to try to reduce the time it takes for a survivor to get access to services. Because we know that often when a survivor is in need of services, it's urgent. Like if they don't get those services, whatever it is, they could end up being exploited again. And so to speed up that time and to become more efficient at referral is really important.
Thank you. That's awesome. That's really, really helpful, and I think speaks to what our network and our affiliate network would want to know about the way you're doing things. I think even kind of digging further into that, what is something that you would like child welfare practitioners to know about the work you're doing?
I think the first thing I want them to know is that our priority is them and that we know we want to be responsive. We are constantly kind of pivoting and changing what we're doing to be responsive to the needs of the field. And so I want them to see us not as a research team that's trying to evaluate or criticize but actually to come alongside and support what you're doing.
Thank you. And kind of in that space, what are some areas that you think child welfare has an opportunity to kind of expand upon the work they're doing with trafficking victims and trafficking survivors.
As a research lab, we're all about data. And so I think having accurate and complete data collection would be somewhere I would really challenge child welfare to move toward. It's a global issue. So it's not like somehow criticizing Florida or child welfare, but accurate and complete human trafficking data is a challenge all over the world, in our state, throughout the US and globally, and to see what's working, what's not working, how big is the problem, what's the scope of the problem, where is it, who are the most vulnerable individuals. Data is not there just for data's sake or research sake, but it's there to answer questions and find solutions. And so collecting useful data would probably be, and I know that there's a push for that. And I think Florida's a leader in understanding the human trafficking problem based on data. But that would be my encouragement is absent data, it could appear like there's no victims. It could appear like it's really not a problem. And there's no foundation for evidence-based practices and policies if we don't have the data.
Because you've given a good overview of what the work you're doing is, I wanna kinda highlight some of the things you've found most rewarding about this work. So can you talk to me about, like, some of the biggest victories you've had or some of the biggest, like, successes or growths you've seen in your time with the lab?
Probably the most rewarding thing is seeing research getting connected to policy. So, for example, I can remember my first research project, I worked on domestic minor sex trafficking and was it being identified in Florida and was Florida responding? And in that report that I wrote up collaborating with Shared Hope International, I found that often when people called into the child abuse hotline, that human trafficking was not being necessarily collected because it wasn't a caregiver abuse, right? And as soon as that report came out, it couldn't have been a month, maybe a week. I got a call from whoever was in charge of human trafficking with Department of Children and Families asking me about the report. I thought, I don't think many researchers have that experience to have their research really get connected to policy and change almost immediately. It has been very rewarding to work in Florida. It's probably a reason why I've stayed. Not that I don't love sunshine, but it has it has been very rewarding to see research get connected to policy in such a quick and impactful way.
Thank you for that, and I think that's a sentiment we share here at the Institute, so I think that's one of the reasons that we enjoy any opportunity we get to collaborate with you because we do love that direct translational piece of the work.
Please reach out to us. I think we have a website, we have an email address. We're pretty much very transparent and public facing. And so, another aspect of the needs assessment, there was quite a few people that ask about evaluation research. So, that is very lacking in human trafficking, is evaluating programs and seeing if they're working. And that is something that we're very keen to do. And so if you have a program and you want to know, like, is this working? Is this training I'm doing or this workshop I'm giving or even some kind of treatment that I'm doing, if you want to see, like, is it working? Please reach out to those. I love working at USF because we have a huge cadre of very world class researchers here who are very interested in human trafficking. And we have 40,000 students who are at USF who and many of who are interested in human trafficking. So we have some labor here that can help you with any kind of evaluation research that you're interested in. If you're interested in the Bright Project, please reach out if you want to be part of that network. And also, we are working on creating a second annual state report on human trafficking for Florida. And so, if you have data that you think would be useful to include in that or some special topic that you want to contribute, please reach out to us. We want to collaborate with you.
Excellent. Can you talk to me a little bit about the outward facing and community engagement events like town halls, things like that on your social media?
The Bright Network is very forward facing and engaged with the community and victim advocates and all those that are advocates that are working in the human trafficking space. And I just want to say, please reach out to us and check the website for those or social media posts regarding those. I know there's at least something weekly going on. And just as a former practitioner who worked as a mental health counselor prior to working as a researcher, I know how important it is to network with one another and to support one another in this work because it's very stressful and you need to think a lot about self-care. And I think networking with one another is a really important way to keep yourself motivated and healthy in this space.
Awesome, thank you. Is there anything else you wanna share with us that you want to maybe include or think along those lines before we close out today?
Many of the things that make us really enjoy Florida, the weather, the sports events, the tourism that makes Florida such a great state, also bring with it vulnerabilities and risk for human trafficking. We've always known that Florida ranks, as one of those top states with the human trafficking problem. And we did our first victim survey this year. We conducted a representative sampling of adult Floridians, so anyone ages 18 and up, and 3% of the respondents reported that they had experienced sex trafficking as a minor and 4% as an adult. And there wasn't a lot of crossover. So if we look at that as a complete total, it was a little over 7% of the respondents reported having experienced sex trafficking. And we maybe have a huge risk problem and we have a lot of community risk, but we also have a very impactful response to human trafficking. And so I don't want to discourage anyone in Florida from thinking, this is a battle that we can't win. But I think having that concerted effort, pulling together all partners from child welfare to law enforcement to service providers, when we all pull together and work together in Florida, I think we can make a significant impact.
Excellent.
I'm hopeful that having those numbers will really motivate greater intervention and greater response for prevention, for protection, for prosecution across all of Florida.
Well, very cool. Well, thank you again so much, Dr. Reed, and, I look forward to any opportunity we get to collaborate. If you're interested in learning more about this episode and our guests, please visit our website at ficw.fsu.edu. Thanks to our producer, Dave Heller, and thanks to all of you for tuning in. I'm Lauren Harrod for the Florida Institute for Child Welfare.